PBMs are robbing you day in and day out, making you work for below-cost reimbursements. Billion-dollar corporations hurting hard-working independent pharmacy owners as they line their pockets and put so many of you out of business. And now it's happening with so many pharmacy software vendors that have sold out to billion-dollar hedge funds. Are you truly happy with your pharmacy software vendor? Is support what it used to be, or you find yourself waiting on hold? Are your issues resolved in a timely fashion? When is the last time you took a look at the bill from your pharmacy software vendor? Perhaps it's time for a change. Visit our website at www.datascanpharmacy.com and give us a call at 1-877-222-7979.
It's the podcast that shakes and stirs up pharmacy. Welcome to PBM on the Rocks.
Welcome, everyone, to PBM on the Rocks. I am your host, Jeremy. We are joined today by Trent. You is your secretary, aren't you?
Secretary, that's correct.
Yes,
that's
secretary of the Alabama Independent Pharmacy Association. And Trent is a friend of ours. He has been awesome. What they're doing down there is incredible, and we'll get into that in a minute. We are joined, of course, as always, by our executive director, Monique. As wonderful as always.
Thank you. I'll pay you later.
Yes, thank you. And also, Brandy Chain, the Texas tornado herself.
Hello.
Hello. And Andrew, just Andrew.
Just Andrew.
Andrew doesn't have a last name. He's like Prince.
That's right.
Just Andrew.
Just Andrew.
An enigma.
He is an enigma, and I really want to get him a Prince sign as his name tag.
Yeah. Oh, I don't see
Oh,
why
yeah.
not.
It would fit. No, we'll make it a different one. We'll make it an Avett Brothers looking one since you look like a fucking Avett brother.
Yeah, I do look a little bummish. I forgot this was a video thing. Every time. Gets me every time.
Every time he just rolls in, he's like, I'm expecting a banjo at some point.
I'll
Play his folk music.
A little deliverance action. Yeah.
It's okay. At least you don't have hillbilly teeth like me.
Playing spoons. Hillbilly people make this country great, Jeremy. Don't you forget it.
I love the hill folk. I am a hill folk. Speaking of hill folk, Trent, tell me everything happening down in Bama, because what you all are doing is incredible.
Yeah. So about this time last year, there was a bill introduced in the House. Pharmacists carried it, and it was a decent PBM reform bill. Had the spread pricing, the rebates, the like NADAC plus a dispensing fee in it. Got absolutely crushed. Called it a prescription tax by the opposition. Which, by the way, little background. Blue Cross Blue Shield of Alabama. That's my insurance. Great insurance. They also own 95% of the market, the commercial market here in Alabama. So they basically run the state. When it comes
Did you just
to
call them great, Trent? How dare thee?
Everybody thinks their insurance is great. Everybody hates insurance companies. I've learned that. Everybody hates Congress or the government, but they love their representative or legislators. I've learned that.
Oh, that's
fine people on both sides.
Well, I hate my insurance too.
Yeah. Yes. In this fight, I'm not a big fan of Blue Cross Blue Shield, but yeah. So big beast. Alabama's just everybody told me it was different before I got into this. Leadership at APCI told me that. And I'm like, whatever. We'll take them on, whatever. And turns out they're right. It's a pretty big beast. You gotta go up against.
Mm-hmm.
So last year, a bill got killed. Public perception was just bashed of it being a prescription tax. Of course, everybody buys in. I'm as guilty as anybody. You read the headline, you believe whatever's in the story from the headline, right? So you got to get away from that.
I remember seeing that prescription tax stuff coming out of
it. Was smart. I mean, touche. Like they did well. The opposition did well, and they won that round. Ever since then, we kind of vowed, me and the owner Darden Heritage, who I worked for at Star, we kind of vowed that we would not let that happen again, because we kind of were caught off guard. And you can't play catch up in these things.
Right.
So from that moment on, about mid-March, we started, mobilizing pharmacists, which is extremely difficult to do. All pharmacists want to do is fill prescriptions until A, they die, or B, they go out of business. And I mean, they'll do it. And unfortunately, that's, it took enough people looking at their bank account, I guess, and realizing that I'm filling more scripts than ever and I'm not making any more money or I'm going negative, to realize, hey, maybe something does need to be done. And actually, nobody is going to come do this for us. It's going to have to be
backs against the wall. You can rally people when their back's against the wall.
That's right. So
give them something to believe in. They'll come out swinging.
Exactly. So ended up through some crazy course of events, hooking up with 4 other owners. One of them's not a pharmacist, but an owner.
All at once?
Yeah, it was a fun night. But it was but no, it's so got to meet some people. And we basically decided, well, nobody else is going to fix this for us. We got to fix it ourselves, right? Like we can't depend on, an association. They're going to be just fine whether we go out of business or not, to be honest. We have to do this for ourselves. So we decided, what do you do when you don't know what the hell you're doing? You copy off somebody else's work that does pretty good. So we copied off 90 and 96 and we started writing a bill.
Yeah, you did.
I mean, if you're going to copy somebody, copy Greg, right? So, no shame in that at all.
Good call.
So copied his work. We actually brought it to him for him to vet, and he was like, yeah, this makes sense. Great bill. Ended up finding a sponsor in the Senate, and the association at the same time was trying to push a weaker bill. And we're like, we're not going to do something that we don't want to, no offense. So worked with the Department of Insurance, which is our enforcement entity in Alabama. And so anyways, get 20 something co-sponsors out of 34 senators. After all the infighting's over with between us and APA and my bill's better and no, we needed to go with mine and mine was passable and blah, blah, blah. Finally sit down like, look, we're not going to win unless we're together. Right. So This session we've finally come together. We're working on a skinny bill. And we're still trying to determine what's passable versus what's the right thing, but we can't have any more moral victories at this point. And I think everybody's there, right? In every state.
Absolutely. And I just got to say, Trent, I am so incredibly proud of you all for doing that, because that has been tripping up legislation on the state level for so many years, is infighting amongst the pharmacy groups and finding a way to bring them together. And that's been a big thing here in Virginia, is a lot of internal politics and discontent, and finding a way to bring everyone together and stay on message. Like, that's how you do it. And I'm so proud of you all for getting to that way, because it's something where you can try to prod people to do certain things and you can try to encourage them, but unless the people in charge are there and their hearts are there and they get to that place both mentally and emotionally, you can't force it as much. Like, you can do workarounds and you can facilitate it, but you've got to get buy-in. And the fact that you all have all come together and you're getting buy-in now, that's a huge step forward. That gives the bill such a better chance.
I think so too. So 2 things I think that's happened differently this year than it's happened any other year. First of all, last year, the pharmacist that carried the bill by himself in the House just got destroyed in the media. He's getting death threats to him, himself and his family, his kids. They were going out. He still owned a compounding pharmacy, but they didn't have any contracts with PBMs. But they were, attacking his business by, reviews and everything else and reporting him to better, whatever. So felt bad for that guy. And I was like, I want a redemption arc for you, right? Like, I want you to be able to come back and have a win. So that was one of the things that motivated me to get going. But we did try to start with the association. They felt they had it under control. I feel like any association, they're afraid of letting others do without their oversight and their purview, because they're like, oh, you're going to mess it up, right?
Yeah.
And, we all know this enough. We're not going to mess it up. We're not going to say the wrong thing. Like, we're all going out of business. We all see what's wrong,
The truth.
So
the truth,
it was, and they have, they have one lobbyist who I couldn't imagine having to try to wrangle 150 something people as one person. Like, you build relationships, that's great, but one person's not going to go up against Blue Cross Blue Shield of Alabama.
No, you got to give them
say,
support. Your lobbyists need support.
Yeah. So, having 20 people in white coats, or, we had our own little yellow buttons that, said whatever, no PBMs or whatever. Just seeing us there, having a presence in the state house, A, it made them respect us more and listen. B, they were really, really encouraged to get us the hell out of there, because they didn't want us on their floor anymore, seeing us every day, standing in the hallways, getting in the way. But it helped build rapport, helped build credibility, and they can't forget about us because we're there every day, right?
Yep.
So this is not what I had on my bingo card a year ago, being in the state house in Montgomery. My wife's been an absolute angel, be wrangling our 4 and 3-year-old girls while I'm gone. But this is something that's like, this is the exit. This is it, right? The final countdown, whatever you want to call it. Like, it's got to happen now.
Has to happen now. But time's up. Yeah. We got to get things done this year.
Mm-hmm. Mm-hmm. Yeah, Trent, I really love that story, because I think it represents well what has to be done. There's a point where you can't delegate the survival of your industry. And I do agree that there's something in an old model that keeps operating around most of the, at least, state associations that we've interacted with, where this idea like, let us handle it. And it's not handleable anymore. Mm-hmm. I do think there's something to be said about, pharmacists showing up in their white coats and being there and looking eye to eye, with those legislators. I just really congratulate you. That is awesome.
Thank you. We had a lot of guidance. It's been very cool to see. Like 2 years ago, 3 years ago, I saw the independents as competition. Like, you're taking my patients, whatever, but hell, they're the only allies we got.
Yeah.
Like they're the people, and it's been cool to see. Like, so my father, I'm a 4th generation pharmacist. So my father lives about an hour away. He has a store, and one of my best allies, great friends, helpful guys through all this, is a guy who has a store like 4 miles away from it. And it's just funny how, like you said, your back's against all this desperation. All of a sudden, you're in the foxhole together, right? Yeah. I hope it stays that way. I hope we keep it that way, because we need it to be that way.
Yeah.
There's enough business for everybody. My gosh.
There is. And it's one of those issues where we've got to come together and we got to stay together, because we've just been fragmented, and that goes for pharmacy. That goes for, other healthcare professionals. Yep. You got to make allies. You got to make allies with patient groups. And, that's how you really, really start taking steps forward, because together we are very powerful, more powerful than their stupid little lobby, because they're backed by a checkbook. Checks don't vote. Dollars don't vote. Like, it's useful, but in today's age of social media, having people with powerful voices, community leaders out there pushing this kind of stuff, that's more powerful.
Absolutely.
I was just going to say, even just bringing different ideas together in a forum, like what works in one state might work in a different state, and bringing people with great ideas together and putting them into action in different places has been amazing to watch.
Hey, I just followed, like I said, copying the people that are successful. I mean, I followed PUTT's example, to be honest. I mean, not to be a bootlegger, but like, seriously, I followed you guys' example of, you get after them. I think the only thing more rabid than pharmacy Twitter is probably Auburn Twitter in basketball, because they will go after somebody if they lose to Auburn. So yeah, you get more attention by doing it organically. Like, they're going to trust you, right? Like, they trust you. They trust your pharmacist. Like, my gosh, my pharmacist here is going off and ranting about these, greedy insurance companies that are stealing everybody's money. And they know where to come find me. They don't know where to come find some influencer or, we ran through that not in December with the federal stuff. Like, you can pay an influencer, but no, at the end of the day, nobody's going to really listen to those people.
No.
And like, they trust you. So it's been fun.
I just want to reiterate one thing that you said, because I think it's really important. So I bought my pharmacy in 2020. And at the time, there was this old way of thinking of, like, the other independents were competitors. And it had sort of like been ingrained in me through the years. And when I bought my pharmacy, and then I started I needed to ask questions. And I was like, oh my gosh, like I have to call this other pharmacy owner, but oh my gosh, can I do that? And I even like talked to like one of my employees who'd been there for a long time who was like, oh, I don't know. And I was like, I mean, it got to the point where I was like, forget it. I just have to call him. So I just called him up and I was like, listen, I know this is going to be really strange, but like, can I come by your pharmacy? I have some questions. And he was like, yeah, come on. And it just started, it started this movement in our community and in our area where then like we would go to lunch and people would see us out to lunch together and be like, wait, what? And you would kind of laugh about it because really and truly, what you said, they're not our competitors. They're our partners.
Yep.
And so like in my area, it just sort of started building on itself to where now I talk to, other pharmacy owners in my area a minimum of once a week. It's fantastic. Yep. Like, another pharmacy owner and I, we work with the high school. And so we just like had an advisory meeting last week. It's so fantastic. And I think one thing that we've seen happen in a lot of these independent organizations is, we're changing the way that looks because for so long, all pharmacies are our competitors. And no, they're really not. Right. And I just think it's a testament, just what's happening in Alabama. Not only you have two different associations, and it's probably happened before. I just don't know about it. This is the first time I've heard of two associations basically coming together and saying, you know what, we're going to make this bill the strongest. We're going to make one bill and we're going to pull these pieces out and we're going to work together and make sure that the most important parts of this are what gets put into this legislation. It's the first time I've heard of it. This is really, I think this is an example for the future for organizations of how you can get these things done at the state level. Imagine if you could put together 3 or 4 really good bills. Okay, let's come together. Let's hammer this out. What are the most important parts? And then you could get some real reform done at the state level for sure. Yeah. So absolutely. Kudos to you guys. This is really cool. I'm so excited.
Thank you. And, it's at first, and I think there's probably still some hesitancy from the main state association who's been around for 40 years or something. There's some pride there and they think we're, kind of the same thing, right? Like between independents, we're taking their part of their pie, right? In all honesty, I think the tide rises all ships, right? So I think honestly, we've probably kept them a little more honest and they probably worked a little bit harder because there's somebody else there that is a measuring stick in keeping them honest, right? So it's I think it helps out both. I think you complement each other. State associations, they can do CEs and conferences and all that crap. Like all we care about is we're the guys you call in when you need something to get done, right?
Yeah.
And all we care about is independence. We don't care about hospitals. Love hospitals. We don't care about hospitals. We don't care about chains. We just care about independence. If our interests align, that's great. If not, good luck to you. So I think it helps you keep each other honest, but it also helps amplify each other. It's independents are something else. Like it has been cool to see all the talents that you can find in independent pharmacy and how well they can apply them to anything, how adaptable they are. It's been very, very cool to see. At the end of the day, we all want the same thing. We want reimbursement. We want to be able to keep our freaking doors open so we can take care of people, right? So it's crazy 20 years ago that we would be even having this conversation because 20 years ago it's just a greedy pharmacist, and now, you can't say we're doing it for the money,
That entire argument is out the window.
Yeah. So,
but at the end of the day, we're still business owners, and we have employees that depend on us for paychecks, and we have, aside from that, obviously we have patients that depend on us, but we employ people who have families and, they are contributing members of the workforce and they are connected to our communities and, making sure that our businesses remain viable. that's providing income into those communities, which on that point, I would like to talk about. I just remembered. Let's talk about for 1 second in the hearing when you stood up and talked about the revenue
Oh yeah.
that was being taken from Alabama and into the state of Tennessee. And I have never seen so many legislators wake up, sit up, and it was like, everything stopped. And they were like, hold on, what, can we go back to what you just said?
Yep.
Yeah, you snapped some necks. They needed some neck collars after that comment. That was awesome.
So for the people that didn't see us, tell us about the story that you told.
Sure. So back when we still had competing bills and between the two associations, two groups, during the public comment period last Wednesday, I was one of the people that spoke, and I was kind of chosen to speak, not because I'm some eloquent speaker, because, to be quite honest with you, I don't like going and watching myself speak after the fact because it just makes me more self-conscious. But so you
don't strike me as a shy man, Trent.
Well, at this point, it's like, I'll talk if that's what keeps the doors open and keeps my coworkers employed, right? So, I'm going to do what I can do. But yeah, so the reason I was chosen is because I had this weird, unique situation. We own one store in Tennessee. It was purchased in 2022. It didn't make sense financially. It just was the right thing to do, kind of. Like the owners were in a very bad spot and it was just going to disappear. And it's been there since 1892 and blah, blah, blah. It's a very cool store. Wonderful people there. And so a year and a half later, we're like, oh, well, doesn't Walgreens already central fill out of Memphis? I'm like, why Memphis? It's like, maybe it's the logistics. Like, well, maybe it's because of the law there, because it's expensive drugs, not cheap drugs that they're filling there. And so we're like, oh, we could do that. We can do the same thing for our stores. So, put a PowerPoint together with my third grade PowerPoint skills, got on the board of pharmacy in Alabama for a license to central fill out of Tennessee. And next thing you know, I think we ramped it up in August, I believe. And the other 7 stores in Alabama are benefiting off of, the model that Tennessee has. I believe it's around $12 million we've sent up there because, again, we're doing like expensive drugs, not your lisinopril. There's some efficiencies there, but it's mainly we keep the doors open efficiencies. And patients are cool with it because they don't have to go find, their freaking Ozempic. They don't have to go somewhere else because we can get it. And, honestly, it's not something I want to do long term. I want to get something passed. And that's what's also, motivated me to get something passed so that I don't have to keep those poor people in Tennessee filling prescriptions for 8 stores. So, I didn't realize it was going to get such a reaction when it did. And then what really drove the point home was this is the same patient that we just filled this, say, Ozempic in Alabama at one of the other pharmacies and lost $150. And then we turn around and bill the same patient, same day, same drug in Tennessee. And then they paid us $13.16. So that really opened their eyes to the willingness of PBMs, insurance companies, whatever, to actually be willing to pay what it costs in states where they require it. So, it was a good point. I don't know if anybody else is doing anything like that. It's a very unique situation. It's helped. But yeah, it's I will say it's been a pain.
I'd say.
But yeah, it's
but it's kept your doors open, and
it's a means to the end. It's a way to survive, which is all we're trying to do. You think, I was talking this morning to he's a part owner in like 60 stores, right? Like Georgia, Alabama, Florida. We were walking out of the State House together, and he's like, our economy of scale basically just offsets the admin fees. We're not making any extra money. Like all of our buying power, all of our efficiencies, all we're doing is just offsetting the admin fees and making it a little easier on the people that are in the stores. But we're not making anything extra right now, which is insane to me. Like, it should not be that way.
Yeah.
But it is. So,
yeah. Pressure makes diamonds, but also this is so much pressure that it's not like we can come out and just have innovation carry us on its own. Like the reason it works in Tennessee is because they got laws passed. And that's important because a lot of people are like, oh, look at what's going on over here? That's not an answer. It's, it's something they've got that you've got to do in the meantime to not hemorrhage money. And a lot of people love to point to this or that. Oh, look at the way they're innovating. Yeah, they're still it's still a huge mess. And it's only possible because those Tennessee pharmacists pushed those laws. Yep. So it's still important to keep doing this. We're not going to be able to innovate ourselves out of it. And yes, market solutions are a big part of the pitchfork.
Yeah.
But
we're talking about
you've got to get it all together.
Well, yeah, we're talking about companies with more money than nations. So it's not like you can just innovate your way to get an upper hand on them, right? I mean,
no, you're not going to do it.
Not going to happen.
You could fully make a product that would completely put them out of business. They wouldn't be needed anymore. You could antiquate the entire system and it still wouldn't get a foothold because of how much power and really influence they have.
Well, right. And it never hit me until around December when all of a sudden I couldn't understand why all of a sudden all these regulations in the federal level fell apart. And it's like, well, the stock market is, the baby of the administration, I would imagine. Right. And, that's not what he wants to hurt. And these companies are so large, they have such an impact on just the market in general. Yeah. And the shareholders, I'm not trying to go down that rabbit hole, but it really hit me just how big they are and how much influence they have on everything else between them. And then, the buying side, it's just, oh, what a mess. Yeah.
It's disgusting.
What are the PBMs saying in Tennessee? I did see where I think it was was it Blue Cross guy that basically was like, yeah, we're for transparency, or was that Prime? I can't remember.
So, I mean, they just keep doing the same gaslighting that they have been. Are you talking about during the public comment?
Yes.
So they're like, yeah, we're all about transparency, which the Blue Cross lobbyist, he was like, yeah, no problem. Like, we only underpay on, 20% of claims, but it's like, yeah, but you're also paying me 48 cents for something that cost me 46 cents. Like, that doesn't count.
Yeah.
Come on, man. But yeah, so, I mean, it was just a lot of gaslighting. It's like, well, we only process 30% of the claims. And well, that's because Prime is subbing out to ESI for the other 70% of the business. Like, you still own the whole market. Let's not be coy here. Yeah. But yeah, I mean, Tennessee's law is not perfect. I mean, it's just says you got to pay. You either got to prove what you reimburse them is available in the state right now, or the PBM does, or they have to pay you what your cost is based on your invoice, which doesn't really drive costs down because then the pharmacy has no incentive to buy cheaper.
We can't buy cheaper. We went over this.
Right.
Anyway, like this whole, let's make them shop around. We can't shop around. That's not how it works. That entire argument is just out the window. Like they like to use it. They like to use it as a way to keep us down. Oh, we've got a market mechanism in place to make them shop around for the best prices. Fuck off. You do not. You have it to control everything and to pay us less. It's not possible. And we got into this with Shabir the last episode about how that forces pharmacies to look elsewhere for the better price, and they're getting counterfeit meds. Right. Because we shouldn't have to do any of that.
Yeah, no. I think that's a really important point to be fair to the legislators, not to be fair to the lobbyists who create this nonsense. But, when you are trying to understand something that's been made intentionally very, very complex, it can be easy to fall back on thoughts like, well, can't you just bargain shop? And I think the single most impactful takeaway I had in our last episode was that there are no deals in buying drugs. And if you're getting a deal, you are probably not dealing in a real medication. And that was the first time in all these years that I acted where, I hadn't even thought about it that way. It was like, what, that is scary when you think about that. And I think the public would be freaked out if they stopped to think about what that meant. So
sure. I'd open up a few bottles and just make sure there weren't rocks in there after talking to Shabir.
I know. It's so scary.
Like, man, that's crazy.
Shake them around a little bit, and you're like, that sounds legit. I think we're okay.
Yeah, but you can't buy it cheaper. So it's
the more concerning ones are the ones that are that you have to dispense the original package, that like no one's ever checking that. Anyway, we won't go down there again, but
Well,
just
so
If you're gonna get paid if you're gonna get paid 40 cents for something, you can't buy it cheaper anyway. What was the matter?
yeah, what is cheaper? Right, exactly.
Yeah.
Yeah.
I
mean-
saved $1.
You could.
Oh,
yeah.
okay. Like, and it cost me $15 to get it out the door. What's it fucking matter?
Exactly. And you feel it, and you feel it cost you 25 cents and you make 40 cents. Like, you can't fill that safely fast enough, I would at least argue. Probably fast enough, period, to ever make up the money that it costs for you to do, to fill that prescription.
Yeah,
Trent, you
organization.
make it up in the other medications. You make it up in the other ones is what they say.
Yes, but also you're talking about organizations that will literally send checks for 1 cent.
yes,
Yes.
yes.
What we do with those is we hold on to them until they go to the Secretary of Treasury at the state, so they have to issue another check.
Yeah.
Yeah.
Pin him to the ceiling like a dive bar. That's
That's not a bad idea.
I think that's a good idea.
Yeah, so there.
If you don't fill those prescriptions, they're not going to come in and buy toothpaste so that you make up the money, Trent.
Yeah, exactly.
That's been my favorite argument is they use drugs as a loss leader. Who uses millions of dollars of drugs every single year as a loss leader? Like they do that to sell knickknacks.
90% of your business is your loss leader.
Exactly. And it's like, are people coming in and buying pallets of toothpaste? They're not. Like, what do they think is happening?
Well, I can tell you they're not in Alabama. I don't know
We
if
have
they
to
are.
get an offsite storage for all our.
We don't have enough teeth
toothpaste
in Virginia.
I'm in the mountains. No, we don't.
Yeah, right. Yeah. Sorry, I'm just kidding. I love you old people.
Yeah, we're used to it.
It's the mountain hicks versus the snow hicks.
Right. Yeah.
That's right.
It's a nice 51 degrees here, Jeremy. I know you were concerned about the weather up here.
Oh, man.
But Trent, I do want to revisit something that you said earlier, and I think it's really important that we touch on this. Is you modeled what you did after what we did, and I really want to dwell on that for a while because I love adoration.
Bask in it. You deserve all the glory and fame.
If you could send a trophy with a nondescript crotch region to Jeremy, that would be great.
Yeah.
So we started doing specialty pharmacy in our main store back in like 2016. We actually got in Prime Specialty Network in 2018. We had to be dual accredited within a year. We did it with URAC and ACHC. Unbeknownst to us, normally like the hospitals and stuff would ask for an extension. We didn't know that, so we just did it. We ran it for 9 months, and then all of a sudden they kicked us out. I guess they saw the trajectory we were on.
Oh, that's ridiculous.
Well, went to arbitration. By that point, it was COVID. And, of course, Prime does Prime things and, said, oh, it was an oversight. They were only supposed to be in oncology. And, I mean, the contract says general specialty. It's every specialty med on, that you can think of. But anyway, so they just said, well, you both go your separate ways. You got to win. You got a windfall and whatever. So we have seen patients suffer because, I mean, hell, we have, 9 patient care coordinators that work in Alabama, not somewhere far, wherever, It's frustrating seeing like the state employees insurance or the teacher's insurance. They have a specialty medication and that stuff's getting shipped from out of state, and that's tax dollars paying for that. Like, no offense to Indiana or Florida or anywhere else, but like, why are you not spending tax dollars in your own state?
Yep.
Especially with qualified pharmacies that are already here.
Yep.
So that's, I've been trying to beat that drum a little bit because, I mean, y'all have seen the Nephron chart or whatever. It shows the profit breakdown, and about 50% of it now is mail order and specialty for PBMs.
Yeah.
So there's a lot of savings to be had there if we can, get some people to wake up.
That's what makes me so mad whenever it's just like, oh, if we move to dispensing fees, it's going to cost the state $20 million.
Yeah.
Bitch, shut up. Like, look at how much you are price gouging on all this, and you're upset over us getting dispensing fees. That's the thing that kills me, is they've become so fucking greedy that they cannot let us have something as simple as a dispensing fee when they are making way more, and they would not have the spotlight on them nearly as much right now. There'd be people out here calling it out, like we'd still be here calling it out, but no, you wouldn't have like this entire movement to regulate PBMs. People still wouldn't know who they were if they wouldn't have been so greedy and tried to squeeze us all out.
Right. But the word's
That's
getting
what's
out.
so
Like,
insane.
yeah,
Like
word
that's why I
is getting
say
out.
it's like in Lord of the Rings. That's what I always compare it to.
Okay.
You compare
And
it
it
to Lord
sounds-
of the Rings?
Yes, it sounds nerdy as hell.
Let them go. It'll be fun.
It sounds. You didn't read my paper that I sent you. Clearly, Monique.
I
It
tried.
is.
Yeah, your eyes glaze over.
Bless you, Monique.
Yeah.
I knew she'd hate it. It hurts my heart.
What part of Lord of the Rings are you comparing dispensing fees to? I'm just trying to map it on. Is it when
I
they
started my article with the quote: "The dwarves delved too greedily and too deep. They
Yes.
knew what they woke up there. We're the Balrog,
which is the what again?
the giant monster that they." You've read Lord of the Rings, haven't you?
I'm in
I saw
Alabama.
the
I can't
movie.
read.
I saw Peter Jackson's extended cut. Oh, and I had it with subtitles. Does that count as reading?
Yes, it does.
All
I
right.
just assume you'd read it because you've read Dune.
I mean, I have read Dune. Dune's amazing. But anyway, are you
Dune's
talking about
amazing.
the dragon that's in the pit with all the gold coins?
You shall not pass. Like,
No.
like
Yes, you shall not pass. That's the Balrog.
red pricing. Is that what it is?
Yes,
I'm just here for
that's
second
exactly what it is. The dwarves got greedy and they dug too deep and they woke up a Balrog. That is the metaphor. That's
Wait,
what I always use. And I do not give a shit if anyone thinks it's nerdy because it is apt.
And I'm sorry, who's the Balrog again? Is it?
We are the Balrog.
We're the Balrog.
We're the Balrog.
We're the good Balrog.
We are the Balrog.
Oh my gosh.
Okay.
Oh my gosh.
I know.
Put
Every
that
time
in.
I write a paper,
So
Monique
that-
puts me through the ringer because I use a metaphor she hates.
Andrew, what's happening?
I mean, I'm always just looking for
So-
how to relate this to the most number of people, which brings me to my question. So, who is Kate?
We're
Blanchett?
related it to pharmacists. Most pharmacists know this. I guarantee you.
They do. Most pharmacists know that they're the Balrog.
Yes.
No.
They will know what a Balrog is.
They
So if you
don't.
walk in a
Do
pharmacy and
not.
say, "Are you the Balrog?" They're going to say yes.
Goddamn
are.
right.
Right.
Okay. You're sure about this?
Yes.
I must just be a bad pharmacist, actually.
I think most pharmacists know what the Balrog. Most pharmacists have seen Lord of the Rings. I think so.
Well, I saw Lord of the Rings, and I don't know which one of
I'm
the three movies
crying
Balrog
over
showed
here,
up
like, I'm
in. Was it
If you
the,
call somebody a
the
Balrog
first
in
one.
Alabama, you'll probably get shot.
the first one? Which scene in the first one?
Oh my gosh.
Well, this is off the rails.
Oh wow. Wow.
Like, wow. It's been a while since we've had one of these.
Sorry,
My,
sorry.
My second
Reading into
gift in life is
Oh my
torturing
God.
metaphors. Thank you.
Oh my gosh. I'm
Yes.
literally crying.
Monique, that's she will tear my papers a new one, but they're so much better after she does it. And this last one, I didn't have time for her to review it because I came up against the wall.
And so
And I
it's
sent it to
terrible.
her.
So you're saying
Yeah, it's going to be terrible, and I know it's going to be terrible now.
I knew something was up when I read the dwarf quote. I just, was not. Anyway, it doesn't matter.
She didn't get past the quote, Jeremy.
Yeah. She was going to read it.
Now you know the hack to get anything past Monique on what you want to put. Just like the first
Yeah.
paragraph. Tie
I'm
in,
going to put a
tie
quote
in
from
Lord of the
Yeah,
Rings.
like War and
And
Peace.
then say
Revisited.
whatever you wanna
This is the best
say.
time.
Start with a metaphor and
She's just going to be
close it
like,
out.
all right, go for it.
I
Say whatever
actually
you want.
thought about Monique when I put that in. I was like, she's going to get this.
So
Sorry,
Monique,
God.
I had a metaphor today with members of our association that I think you may be proud of.
Now
We
we're
were
back.
talking about our legislation, right? And we were like, all right, reimbursement is the Christmas tree.
Trent got us back on track,
Here
everyone.
we go.
Sorry, I just
Cut the
thought
last
about
20.
metaphors, and I was like, I had a good one today. Said reimbursement is the Christmas tree. Enforcement is the stand. Everything else is decoration. It's popcorn tinsel or
Yes.
whatever,
Yes.
like ornaments.
Yes.
You don't have the stand in the tree. You ain't having Christmas.
That's
Yes.
beautiful.
That's
So-
so nice. You know what? Oh. Can we use that for our Christmas card this year?
Oh, that's, yeah. I mean, yes, it's not
I'm sure,
copyrighted.
yeah,
although-
We'll make a special ornament for Trent.
Aw,
Yes.
thanks.
I
My,
like
so
that.
not to get political, that just reminded me my wife
yeah,
has
let's
been
do it.
making these ornaments. So my wife,
Not to get political.
so
Yeah.
I'm just mad right now about the hires. I feel betrayed in a few ways, but we'll see how it plays out. The hires.
The vast number of insurers.
Don
Yeah.
Dempsey.
Yeah.
yeah.
Okay. We just keep
Hey, so
putting.
while we're
Sorry, I
on
didn't mean
the-
to put a damper on the evening.
while we're
I'm
on the
sorry.
subject-
No, it's
No,
fine.
you're good.
Like, we worked with the Trump administration beforehand and helped with language for like the executive orders beforehand. So there's hope. Like,
Swamp
there's
gonna
hope.
swamp.
Yeah.
We're
We'll see.
more optimistic under the Trump administration than we ever were
So,
under the Biden administration.
I have two questions. Speaking of DC, do you guys participate in the fly-in?
Mhm.
Do your own thing. You do?
We'll be there.
So PUTT is encouraging all of our members and friends to be up there for that fly-in.
Okay, cool. I was gonna say, so I had two other questions. One, is there a way for like me to like encourage members of AIPA to join PUTT, or is that okay? I don't want it to be like, I mean, obviously I'm sure you're okay with it, but is that like uncouth or whatever? Is there a way that, you know, I can make sure they're supporting you guys? And then I know you guys have always been supportive of anything, anywhere in any state. So
Yeah.
I think you should have them reach out to the PUTT Action Network and get connected that way. That is probably the best way to do it.
okay. And
And
then
I'm glad you asked that. Go ahead and ask the other question. And I'll answer.
well, the other question was ancillary. You're talking about executive orders that reminded me of, and I've always tried to get in touch with them. I haven't been able to, but power to the patients. Is that a real thing, or is that just like a lot of money backing hiring actors and
I think it's more along those lines. They definitely have some good messaging, but I'm not so sure how much they're involved on the pharmacy side. I will tell you there is a really good group that I recently have had some interactions with, and I think it'd be good for any any independent pharmacy group to get involved with. It's called Patients Rising, and McKay Jameson, I believe, is the executive director. They have a lot of really great things going on, and certainly are good partners for. I'm sorry, my dog is barking.
No, to that end, though, I think getting as many patients involved in the process is just equally as important too.
Where's the funding for Patients Rising?
Go to their website, patientsrising.org.
Okay.
They're
very good. Very, very good.
very good. I've been in multiple meetings with them.
So I think I told you guys this, maybe it was last week. I ran into this group of lobbyists, and they represent the most notorious discount card that you can think of.
Yeah.
And this is when we had two bills, right? So the other bill, not our bill, the other bill had specific language in there about discount cards. So they were pushing for our bill over their bill, right? So they're coming out of my sponsor's office, the Senate sponsor's office, Dr. Stutz. And they were like, oh, I was like, oh, who you with? And like, oh, you don't want to know, you don't like us, but we're with you. We're on the same team. I was like, who are you? Who are you with? And they're like, oh, we're with Good RX. I was like, oh.
They want people using the discount cards more.
But in the unified bill, we put discount cards in there.
You should have gotten all the inside scoop.
Yeah. So
I just now put that together. They want this to happen because they think that the copays are going to get passed down and people are going to use the discount cards more.
Sure.
Those fucking assholes. Yeah, so that makes sense.
Like a light bulb graphic.
Yep.
Yeah. You're like, come on.
That makes sense now.
Okay, like 17 minutes ago, Brandy tried to make a point. Do you remember what you were going to say, Brandy?
Oh, go ahead, Brandy.
Okay, so before we forget, we have to shout out Matt Hendricks and the Mississippi pharmacists. They have been killing it.
Yeah.
So SB 2677 passed the Senate. Now it's headed to the House. All those pharmacists have been lighting up the phones for their representatives in Mississippi. So by the time this airs, this press conference will already have happened. They're actually having a press conference on the Rotunda tomorrow. in the
That's
House.
Rotunda.
So really big deal. So their legislation's really similar to what we're doing in other states. It's a NADAC plus a dispensing fee, which seems to be the thing this year. So, good for Mississippi too. We're doing it in Texas too, by golly.
Yeah, you are.
Yeah, you are.
Fun. Drink to that. That's great.
Excuse me, Brandy, who wrote that Texas bill? Can we talk about that?
That's American Pharmacies wrote that.
Oh, really? I think it's Tori Hendricks. Is it Tori Hendricks? The national accounts guy for American Pharmacies.
Oh,
He was
yeah,
at the
Tori.
hearing last
Tori. Yeah.
I know it's Tori, but yeah, he was at the meeting last week, and he came up to me afterwards. He's like, "I want to help get this done." I emailed him this week, and he was like, "Man, I won't ever forget being there." He said it was so cool to see, 70 pharmacists there, and just people fighting for their livelihood and showing up. And yes, keep calling, send letters, send emails, but like if you can show up, if you can afford to take an afternoon off to get to the Capitol and just get in their face politely, respectfully, and be like, "Look, I need you. You represent me. You fight for me up here, right? And I'm going out of business."
Yep.
Now that you know that, it's on you, right? Like, I need you to fight for me. You represent me. I need your help.
Yeah.
To hell with insurance or donors or whatever.
Yep.
That goes a long ways.
It does. And
your
that's the
teachers,
beautiful thing
listen,
is
anyone listening,
Yes.
you will get your teachers calling. I cannot tell you how many legislators will tell you when teachers start calling, they're like, "Oh no, we're in for it now." Because teachers, they do not back down and they will go to work. If you have teachers as patients, you need to pull them aside. You need to have a conversation with them. They will be your very best allies.
Yeah.
Very best.
That's really good advice.
Yeah. Education is that's the biggest thing that like a grassroots can do is you got to educate the legislators so they know exactly what's going on. So they're not getting fed all these lies. And you got to educate the public because they're going to get fed lies too.
Yep.
And, they have to understand like, oh, well, this doesn't affect me because I'm on Medicare and this is a state level issue. It's actually not going to raise prices because my pharmacist said it wouldn't. And I will come stab him in the neck if it does because I see him 3 times a week.
Yeah.
So,
What's been really useful in my world is hokey Twitter. Because everyone involved in like Virginia Tech Twitter now hates PBMs just because it's been like this weird kind of like cross pollination with it.
Yeah.
That started happening with Auburn as well.
Everyone has those, those niches that they can sort of like tap into, like figure out what that thing is, what that group is that you connect with and use them. Like find that commm ground, go to town and use them.
Word is spreading. I know it's spreading here locally. I don't think it's anecdotal, but like multiple people have said, I'm not just hearing about it in the pharmacy. I'm hearing about it at church. I'm hearing about it, wherever at a restaurant. People are coming up to me and asking about this PBM thing and how can we help? Like people are starting to understand. Like, the age of information is a bad thing for PBMs, and I hate to see
it. Is. Dude, you have done such a good job with Grassroots. Like, how did you do it? Because there's a difference between like getting people together, utilizing your networks and doing everything else on a national level versus a state level. Because once you get in the state level, it's like those branches get down they're a little tinier. It's harder to do it on a state level than it is a national level in some ways. You can get a ton of voices on a national level with your branches, not so much on a state level unless you know what you're doing. And you've done a very good job with that. And I want to hear what you did.
Yeah. So, we did have a lot of good advice from a gentleman who's been in the political arena for a very long time. He did serve as like a state senator back in, 40 years ago. But, he gave us a lot of very good advice and kind of would steer us in the right direction. But it was mainly just like, we had a core group, maybe 5-6 people that you really trust, like, you'd kill for them. Right. And then those 5, that's where you disseminate from. And he would be like, all right, you 5, you go reach 5 more people and you you educate them till they don't have a choice but to follow you into battle. And then they tell another 5, and you spread it out organically that way. That's how we vetted our bill with like 100 pharmacists by doing it exactly that way. And when it came time to call on them, we had pharmacists that were competitors in business, but sending pharmacists to the other stores so like an owner can come down to like that hearing, which is, it's unheard of. Like that, you don't do that. And he was like, if they can't pay, I'll pay for it. Like that's crazy.
That's so cool. I love it.
Yeah.
That's really cool.
So it's, seeing the benefit for all has really helped. We're the transparent, the little guy organization, and like we're the stakeholders, right? Like that goes a long ways with people wanting to trust you and fight for you and work with you, is knowing that they have the same thing on the line that you do.
Yeah.
Which may not be the case with bigger organizations at times.
Right.
So that helped a lot. Just building trust, just being genuine. Just being yourself, even if you're Jeremy, just being yourself helps a lot.
Even if Balrog and everything.
Exactly.
Yeah.
But yeah, it's it sounds so cliche to say, but like it really is that simple. It takes time. You have to have genuine conversations with people. And you have to explain to them that no one else is going to come do this. It has to be us.
Yes.
You don't want to get on the other side of this, being on the sidelines this whole time, and then come up to me and be like, hey, did we get something passed? Because I'm going to say, who is we?
Yeah, exactly. You are. You.
Yeah.
We've been working. I don't know what you've been doing. Like it cannot be that.
Yeah.
We've actually found that getting people over that initial hurdle it's like they're a little afraid to like either contact their lawmakers or do that initial reach out. If you can just get them over that initial hurdle,
I was afraid.
They will do so much more. Yeah, exactly.
I was afraid at first. And that was the first step, right? Like back in July, August was meeting with we have we're in a bigger city, so we have a concentration of representatives and senators here. So, and there's some I knew, some I had no idea who they were. But they have an obligation, but they also are willing to sit down and talk to you. The biggest hurdle we had to overcome was from, hey, this is a problem, because they all know it's a problem by now. I promise you, in any state, any representative or senator knows it's a problem. But showing them, hey, I have the solution. I know it's the solution, no matter what anybody else tells you, because it's worked. It works just north of here, 30 miles north of here. It works in West Virginia, Arkansas. You can start naming off all these states where they've done it, and it works. Like, we don't have to pretend that we're different here, right? And I think that was something that I talked about in the meeting. But yes, you meet with them, you realize, oh, well, he's just an attorney, or he's just, used to be a police chief, and now he's a representative or a legislator. And then you get
That's
down
actually
there.
important what you said, by the way. That's a little aside.
Yes.
A lot of states will say, well, we're different than that because we're structured in this way. We have these different graphics. You're not. Right. That is one of the big arguments that we see. But continue.
Yeah. Well, yeah. So, that's a bunch of BS, which the other argument we've heard in Alabama was, oh, this is a federal, which we're a very red state, one of the reddest states in the country.
Alabama?
No
believe
way.
it or not.
Are you sure?
I don't believe you.
Who knew? Has nothing to do with Alabama, though. Nothing to do with Alabama. And but yeah, so everybody's like, oh, they'll fix it in DC. It's fine. They'll fix it in DC. This is a federal issue. Hammering home the point of, well, they've already decided that the states can regulate PBMs for commercial insurance. So, and they can fix that a lot quicker than they're going to fix anything in DC.
Yeah.
Clearly.
You wait around for DC, you might as well go ahead and shut down your
Had the
door.
same hearing 6 times.
Exactly.
Yeah.
Yeah. The lady from
Today
Colorado
being
was
the last
complaining about that
one.
this morning. She was like, here we are again, doing the same thing. Still a problem. But yeah, so
still putting bad people up there that are saying nonsense.
talk about that, Jeremy.
We're not going to talk about it. I'm going to get worked up again.
Yeah. But yeah, so the other thing that I was really nervous about, mainly I was having PTSD from working at Walgreens and wearing a tie, but was going to the State House. Didn't wear my Walgreens tie, but went to the State House, and it's just a bunch. It's so relaxed, especially versus DC. It's so laid back. Like, they want to see you. They're happy to see you. You bring your kids, you're going to be a hero. I'll tell you that right now. Until they get tired or hungry, then they're going to be like, all right, well, it's time to go. Trust me.
Yeah.
But it's they're just people. They're nice people. They want to do right, and they want to be on the winning side. So if you show them this is the right thing to do, and they're going to be a hero, for everybody, including the pharmacies, they will be more than willing to help you. But it just takes getting there. And pharmacists are probably the worst people to be lobbyists, because lobbying is in the state level. It's hurry up and wait. There's no plan. You don't know what's going to happen in 20 minutes. You're just hanging out to be available to catch somebody going down the hall so you can talk to them, or sneak in an office for 10 minutes. So
we have very different experiences in lobbying.
The definition of how lobbying got its name was exactly what you just described.
That makes sense.
It used to be that what happened was people who were designated to have a specific conversation with a lawmaker would wait in the lobby of wherever the offices were, and they got to be called lobbyists. So that's actually, how that.
The more you know.
Yeah, that's true.
We just called them lounge lizards when we were there, which I thought was pretty funny.
Well, and there's that. The other thing I think you said that was really brilliant is you pointed to what our country was actually founded on, which is citizen legislators.
Yeah.
That who is, so your state and my state and Jeremy, all of our states really have this thing in common, which is that the people who have elected office in our states are people who have jobs in life. And they aren't the experts in anything except perhaps what they might do for a living, or what their particular town or the people they live with are like. And so it requires us being able to see that person as, I think you said it really well, like a former fire chief, or someone who runs a grocery store, or however, a nurse. Some of the pharmacy champions in my state are just simple, and I do mean it this way and respectfully, it's just simple healthcare workers. They are nurses, and there is a guy who runs a family-owned grocery store, and it's a badge of honor. They are independent, people, independent business owners who just want to do right by the state. And our country was actually founded on the premise of states' rights. If nobody believes me, go watch Hamilton. That's a really good example of what federalism is.
Don't get me started on Hamilton. I love Hamilton.
That was a Wes Anderson movie?
Yeah, that's what that was. Yes. Yeah.
Did you know that Balrog was in Hamilton?
Oh my gosh, get out of here.
And I just I know we're going to come to the end here soon, but I just wanted to go back on something. I didn't want to miss this opportunity, but Trent, you had asked about supporting PUTT, and I definitely wanted to extend an invitation to all of your people to do that, and really everybody who's listening to do that, because PUTT itself was founded by independent pharmacy owners in 2011, and it was founded on the premise of if we don't say something about pharmacy benefit managers, this industry will not be around much longer. And so that fight began in earnest in 2011, and PUTT members are almost entirely pharmacy owner, pharmacists, pharmacy techs, patients. And, we have always said for the pharmacy owner or the pharmacist, if you are willing to donate, and we are a 501c3, so it's tax deductible, but if you're willing to donate 1 hour's wage, which is typically $50 to $60, if you could donate that just once a month, that will make such a difference in this organization's ability to be able to carry forward the work we're doing. So we are always there at the state level, and we are always gathering information and finding ways to break it down and creating infographics and whatever we can do. We've got a great social media platform, and all of that is supported by the people who, become PUTT members by donating. So I appreciated so much that you asked that question. And I just wanted to take an opportunity to say, yes, that would be amazing. And to anybody who's listening, we would love, your guys' support, because it allows us to keep doing what we're doing. We've got some big fights ahead.
Big fights. I believe in what you're doing, and I've seen it work. And I emulated you guys, right? Like, if you know what you're doing, copy the people who are doing it right. And you guys are doing it right. You're not you're not trying to justify 200 jobs. You're not here to do CEs. You're here to fight for what's right and keep us alive, right? And that's all that really want. So,
We appreciate that.
And we're here to empower you to work for yourself as well. Like, we're not going to, we're going to do the work, but like, we're going to want you as a partner with us, and we're going to teach you how to do it at the same time.
Of course.
So we're not gatekeeping
you don't know better. You're saying you don't know better than I do, Andrew?
Right? Absolutely not. I promise you I don't. I promise you I don't.
One thing that I love that Monique says is we get our members and we give them their marching orders.
Yes.
And that's how that works. We tell them what they need to do. We try to equip them to do what they need to do.
What shall we toast to close out tonight? I would say to victory in a state where Blue Cross Blue Shield has, what'd you say, 95% of the market?
Yeah.
No, Monique, I'm going to toast to the Balrog. I'm going to pour myself another little bit here.
Here.
To the Balrog, because we're the Balrog.
Okay, we're the Balrog. Here.
The official.
I knew she'd hate it. To the Balrog.
Cheers to Balrog.
The official mascot, right?
To learn more about Pharmacists United for Truth and Transparency and how you can help fight PBM abuse of our healthcare system, visit our website at truthrx.org.